Hi there, I'm Dr. Gary Simmons of Carilion Clinic Neurosurgery, and I want to talk to you about spinal fractures and the concept of stability. Now, spinal fractures come in many different sizes and shapes and implications. And if you remember, the spine consists of blocks of bone in front and rings of bone in back. And through the rings runs the all-important spinal cord, which is the main wiring of your body. So the seriousness of a spinal fracture has a lot to do with how much does it threaten that wiring. Because if that wiring is messed up, then you're paralyzed. So spinal fractures, when we evaluate them, we are constantly trying to figure out whether they could cause problems for your spinal cord. Other problems that we would also be concerned about would be, could they lead to progressive deformity, meaning the spine bends the wrong way? Or could they lead to chronic pain? And this really is the focus of what we call stability. We are trying to determine whether your spine, if fractured, will heal in such a way that your spinal cord is okay, that you don't get deformity, and that you don't get a lot of pain. And therefore, if we think those conditions are met, we say this is a relatively stable fracture. If it looks like the fracture is going to lead to a spinal cord injury or things falling apart or severe chronic pain, then we feel that the spine is not stable, or we call it an unstable spine fracture. It's not always easy to determine. Sometimes only time is going to tell us. Sometimes the fractures are unstable, but only over several months. Sometimes they're immediately obvious. And the different types of fractures can lead to different decision-making about the stability. If a fracture looks pretty darn stable, well, we don't have to do too much about it. If a fracture is very unstable, there's a good chance we're going to want to do surgery to secure it up, to shore it up. If it's somewhere in the middle, well, we may use other tricks up our sleeves like bracing to put you in various types of braces or collars. And we'll talk about this more in our next sessions. Thank you. Bye-bye now.